It's time to wake to sleep with Sleep Science Today, where we learn to sleep well with your host, Andrew Kolsky on UK Health Radio.
Hello, welcome to Sleep Science Today. I'm your host, Andrew Kolsky. Today, we are going to be talking about nightmares, and we have our guest, Dr. Kristi Pruiksma. She is an associate professor in the Department of Psychiatry and Behavioral Sciences at the University of Texas Health Science Center at San Antonio. Welcome, Dr. Pruiksma.
Thank you so much.
So tell us more specifically, where is it that you work and what type of work do you do?
Yeah, so I primarily work with the Strong Star Consortium, which is housed within the department at the University of Texas Health Science Center. And this consortium is really focused on looking at evidence-based assessments and treatments for active duty service members and recently discharged veterans who are experiencing a range of behavioral health conditions, post-traumatic stress disorder, and my focus has been on post-traumatic stress disorder and insomnia and nightmares.
Wonderful, wonderful. Well, I'm so glad to have you here today because we have not had an opportunity to talk about nightmares on this show yet. And because you're doing this work with veterans and service members and all, do they tend to have a higher incidence of nightmares than some people who are not in the service? Or do you have any data about that?
Certainly. We know that about 5% of the general population will experience like chronic frequent nightmares that are, to the level of being problematic. Most people have nightmares at least, occasionally, or at least once in their life. But when you're looking at, frequent and chronic and, where it's clinically significant, it's about 5%. But we know that those numbers certainly jump much higher. And among individuals who've experienced some kind of trauma. So when I'm talking about trauma, I'm meaning things where there's like a threat to life to the person or someone that they know, or sudden unexpected death of a loved one, or also sexual assaults where there's a threat to somebody's physical integrity. So when people experience those traumatic events, the nightmare rates go much higher. And when it comes to active duty service members and veterans, I think in general, there's a greater history of that in childhood, but also as part of military service, there's that's part of a risk that but there's a lot of exposure to those types of things. And so I think among trauma exposed like civilians, the nightmare rates are around like 30-40%. I think in trauma exposed active duty for veterans, it's more like 50-60. But then when you look at individuals who actually also meet criteria for something like post-traumatic stress disorder, it's much higher, like 60-70%. So some people can have nightmares without meeting criteria for PTSD, even though nightmares or disturbing dreams, I should say, are part of the criteria that someone may or may not have who has PTSD. People can have that without meaningful criteria or have PTSD without having nightmares, if that makes sense.
Right.
So, but to answer your question, yes, tends to be a higher rate among active duty military.
Great. Thanks for that info. It's not great that it's higher, but I appreciate the info. So as we get into the show today, I'm sure we're going to have plenty of opportunity to talk about the differences and the types of treatments available when you got multiple things going on: PTSD, potentially insomnia, nightmares, maybe even some sleep apnea in there. Who knows? So in order to kind of get us kickstarted here, can we start off with a description? What is a nightmare and how is it different from a dream, if at all?
Yeah, sure. So nightmares are going to be those dreams that have such intense emotions to them. And it doesn't have to just be fear. It could be fear, but it could be anger or guilt, or shame, or sadness even. So there's such intense emotions that they typically wake up the sleeper. So they, there's kind of debate around that. But usually we think about nightmares causing an awakening, and the dream is very vividly remembered. So I think that that's a really important piece, that sort of differentiates nightmares from some other things. But so there's a well remembered dream, and it is usually a very kind of there's some kind of threat, there's some kind of negative emotion with it. So most dreams actually are kind of negative. Not They're not usually the like happy rainbows and sunshine like we talk about, like follow your dreams. Well, most most dreams aren't really that good. And so some, I think people might have the dreams like where they're kind of flying and they can't quite control themselves. Or another common one is like teeth falling out.
Wow.
Or, so there's kind of like those dreams where you wake up and, you might think of it and you're like, oh, it's kind of weird. And then there's a category that's more what we would call like an anxiety dream. So this is where, it was a very stressful dream, but it may not cause you to wake up, and it doesn't really bother you too much during the day. But so these might be things like one that I have often. Oh, there's two actually that I have often. One is that I forgot to go to a class in high school, and they're going to take away my PhD because I just
Ooh.
forgot about it. My other one is that my husband never actually signed our marriage license, and then he won't want to. So those are ones, I think kind of common that people will have, where it's like, oh, that's kind of bothersome, like that was stressful, but it doesn't like necessarily cause an impact during the day. Nightmare is more going to be, it's kind of really messing with you during the day. Like it's feels like it's more of a haunting, for some people.
Hmm. So, so this is something that I've always wondered. Let me see if I can describe it. So I can understand, someone obviously, especially if they've been in active military service and they have PTSD from traumatic events that have occurred, and then they have nightmares associated with that. That one's easy for me to get my head around. Um, then there's dreams that may be just dreams, like you were kind of saying, related to some of our life events, and it kind of makes sense that maybe it's anxiety provoking for us, so we're thinking about it. But then there's that category of dreams, and maybe I'm the only one that has these. I don't think so, but where you have a dream and it's like really kind of nonsensical. It's kind of weird, not possible stuff, but it's just weird things. Is that a
Yeah.
is that a thing? Is that a dream or a nightmare?
That would be more of a dream. I think if it's not causing you to wake up, or causing like distress otherwise, um, I would say that that's more of a dream. And yes, I think um, most people do have those dreams. The extent to which we remember dreams can vary. I think it depends. On whenever we're sleeping, there's different stages of sleep. So there's sort of like that stage one sleep where we are, it's kind of like a twilight zone. We're sort of aware what's going on, and then our sleep gets a little bit deeper into stage two, and then stage three, and a really deep sleep. And then we have the rapid eye movement sleep. And this is where our eyes are actually darting back and forth. People who maybe have a newborn and they've been holding a sleeping newborn probably have seen this. And this is a time when we have a very active mind, but a very still body. And this is when a lot of dreaming occurs. Not all dreaming, but a lot of dreaming occurs. And interestingly enough, my long answer to your question is, um, during the night, it's normal to just have sort of brief awakenings. We might not remember them the next day, but it's normal to kind of wake up, roll over. And if you're waking up during REM sleep, you tend to remember your dreams more. And so one of the factors that impacts that is what stage of sleep we're in, and also when we're waking up, to determine if, what the dreams are like, but also if we remember them. So it's a little bit complicated and a little hard to study because people are sleeping.
Right. Right. Well, so is there research out there in terms of what percent of people tend to remember their dreams or remember their nightmares?
I don't know about that one. In terms of what percent remember versus don't remember, I probably it is out there. I just can't think of it
Hmm.
right now. But I do know that there are most people do dream, and whether you remember or not is sort of a different thing. I think a lot of things can impact that. I think some of
Yeah.
the interesting studies, though, that they've done is they actually will have somebody sleeping in a sleep lab, all hooked up, and they're monitoring their brain waves, and that's how you actually determine if someone's asleep or not. And
Hmm.
the way they've researched dreams is they'll go in and they'll see that somebody's in that rapid eye movement sleep, and they'll go in and they'll wake the person up and say, "What do you remember? What were you dreaming?" And so that's how part of the way that they've determined, that dreams during REM sleep tend to be a little more vivid, a little more lively, and then dreams in other stages of sleep are less vivid and maybe more of that kind of abstract, like you were talking about. So um,
Right.
I respect anybody who has ever volunteered for a sleep study related research because they do some tough things
Yeah, boy, that would be annoying to me if I was sound asleep and somebody came and shook me to wake me up.
Yeah, absolutely.
I just, again, for me, all I can speak about is my own experience, but it tends to be, I think back when I was in like college age, maybe 10 years out of college or something like that. During that phase of my life, I would tend to wake up and remember my dreams the next day. As I found that I got older, I don't even realize that I'm dreaming if I am, and I don't remember them anymore. I don't know why that is, but that's just been my experience.
Yeah, there's plays a role of well, I don't know. You tell me. How consistent of a sleep schedule somebody had. I think if we're less consistent, our rhythms aren't as like entrained, and I think you might be a little more likely to remember dreams if you're less consistent with the sleep schedule or have more stressors going on versus, you know, um, as we get older, I think we tend to get more in our own rhythms.
Yeah, yeah. Well, I think if they ever did a little cartoon of me, they would do. You ever see that like Energizer bunny with the batteries in the side and it just keeps going and going and going? That's me. So they would put little Energizer batteries in me. So okay, so it's an interesting topic, and I want to dive in more here. And so one of the things I want to talk about next then is conditions that may mimic nightmares that aren't actually nightmares. But before we do that, let me stop for a brief commercial break, and then we'll come back and talk about that. You're watching Sleep Science Today. If you enjoy our show, please help support us by pressing the like button, subscribe to our channel, and hit that notification bell. It'll really help us get seen, and it'll help you stay informed. All right, welcome back. This is Andrew Kolsky on Sleep Science Today. We're talking with Dr. Kristi Pruiksma, and we were just about to talk about conditions that mimic nightmares but aren't nightmares before our break. So we're back. Dr. Pruiksma, the floor is yours.
Okay. So this is actually, there's kind of a lot. You, in some ways, would kind of think assessing a nightmare would be pretty simple, but it's actually kind of complicated. Well, one of the first conditions I think of, that can kind of sound like a nightmare but isn't, also happens primarily in children, and nightmares are actually a common developmental experience for children. And so we get a lot of questions about nightmares in children. But sleep terrors occur primarily in children, and this is when a kid might sit up and screaming. They might be, walking around the house, and it can be really terrifying, more for anybody else in the house than the child. The child actually doesn't wake up. They're acting like they're awake, but they're actually still asleep. And they don't remember. They don't remember a dream. They don't remember any kind of storyline. Like the only thing that they know is, if somebody else in the house like wakes them up, then they'll remember that happening. But otherwise, there's no recall. And so really the advice for, if, while I'm on this, is if that's happening to somebody, is to like kind of gently lead the sleeper back to bed. And to know like, okay, this is a sleep terror, and kind of get them back to bed. Don't waking them up. It really isn't necessary. And then trying to calm down yourself after hearing that. Yes. And so what's happening is like whenever we are in that REM sleep, like I was talking about before, our body's supposed to relax, but sometimes things kind of get out of sync where we're in REM sleep, but also like we're acting out. It's called parasomnia, so this is part of what can happen. And so people can often think, oh, somebody must be having a nightmare and they're acting out their nightmare, but that's actually not what's happening. Sorry, any questions?
Well, I just want to ask you about this. So is that something that typically happens for kids, or can it be any age?
It's more common in kids, but it can be any
Okay.
age,
Okay.
for sure. Yeah. Yeah, so the next one I was going to talk about is a nocturnal panic attack. So a nightmare, there's some kind of dream content that is so intense that it typically causes that awakening. But for a nocturnal panic attack, there's not really the dream content. There's just kind of this waking up, and then maybe there's a thought of something that's very anxiety provoking, or even just like noticing a feeling that can be very anxiety provoking, and somebody might have the racing, with both of those awakenings, there's a racing heart, there's, sweating, trouble breathing, or feeling like you can't breathe, just those different kinds of panic reactions that they look the same, but the cause of that awakening is the thing that's the difference. Yeah, so that can happen. Sometimes people have panic attacks during the day and then also at night, or sometimes they just have those at night, but there's no dream content to it.
So is that any age? I'm just trying to kind of differentiate here between these different
Yeah,
things.
I think it typically is more starts in like young adulthood, I believe, but it could, in any time after that as well. People could experience panic for sure.
Wow, that's kind of scary.
Right. Yeah. It's definitely a very uncomfortable experience. And that's definitely part of the reason why we're wanting to do work to help people be able to sleep better, things like that.
Right.
And I guess like the one more disorder that we would think about that kind of has overlap with nocturnal panic as well is obstructive sleep apnea. So you could imagine with obstructive sleep apnea or essential sleep apnea as well, there's trouble breathing, and which a lot of times people sleep through that, which is kind of such a creepy part of sleep apnea, is that it can be happening and you don't even know it unless somebody's you have a bed partner, somebody kind of noticing, stopping and breathing. But if you do tend to happen to wake up, it could be you're gasping, heart racing, similar kinds of responses. So it's kind of hard to differentiate those three. And you have to do an overnight sleep study to really know if it's sleep apnea or not.
Mm-hmm. Wow. I didn't realize there were so many different things that all might look to a layperson like, a nightmare or something like that. And I was reading a news article. I'm trying to remember what it was now. There was a gentleman who was sleeping, and how did it go? I think he I think he lived by himself, and no, he that this is what it was. He lived with, let's just say, his parents or someone. So he had his own room, and he was sleeping. And in the middle of the night, the parents hear this big crash, and so they go to see what's in there. And he had like run into the dresser in his room and toppled it, and he was laying on the floor. And they said, "What happened?" And he said that he was just like dreaming or something, as if he was playing football and he was going to, kind of tackle a linebacker, or he's going up against the linebacker. And so he ran into him full speed, and he said it was
Oh,
very real to him. What does that fall under?
yeah, I mean that sounds like maybe kind of a sleepwalking type of episode, the dream enactment type of episode. Yeah, and that certainly can happen as well. In fact, going back to thinking about active duty and service members, but certainly other trauma populations, is actually a proposed possible new sleep disorder called trauma-associated sleep disorder that's very much characterized by acting out dreams, maybe cursing, and so there is this REM sleep behavior disorder. It's getting more and more complicated. That tends to happen like in older adults that can actually be sort of associated with like Parkinson's types of things. But we're also seeing in younger active duty military where it doesn't seem like that's the right fit. But a trauma associated sleep disorder is another piece that might be something that's going on. So yeah, it's complicated.
Yeah, I'm starting to realize how complicated it can be. So, all right, so let me figure this out then. So we talk about PTSD. And typically, when I think about PTSD, just by watching the movies and watching things that everybody might see out there, I think of people kind of having these flashback memories of some traumatic event that occurred. And maybe if you're talking about military, maybe there was something that happened on the battlefield. And that can happen to them, at any time. When we talk about what you're describing there, or nightmares, or whatever it may be, does that kind of take place where they're remembering like actual events and those are coming back to them as nightmares?
It's still pretty kind of early on in the research of that. That I think um, it's hard to know. I mean, that kind of sounds like sort of what's happening is like we know that there's an extensive trauma history, or just a history of being exposed to combat over extended periods of time, or that sort of thing, or maybe even potentially some brain injury types of things happening. But that they're acting out the sleep instead of that body being able to relax and you dream without acting. There's something happening where they're acting it out more. And so, yeah, I think the movies and characterizing PTSD certainly, the flashback types of things can be part of it. But I think more commonly is, and is where maybe they're triggered, there's some kind of reminder of event that causes some reactions. But a lot of people don't actually have that like really vivid flashback like they show in the movies.
Mm-hmm.
I think probably the biggest thing that actually can be a little bit tricky to identify is avoidance. Avoiding like internal reminders, so like thoughts or emotions, trying to avoid that. By distracting oneself or working really hard or using substances, um, or avoiding external things like not going to certain places. So the extent to which this trauma-associated sleep disorder and PTSD and all of that overlaps, I think, is just an area that is ripe for further investigation. But it's a difficult area to research. And one other thing I keep thinking about as we're talking is, that when people go into like a sleep lab, those are pretty expensive to conduct. And a lot of times they don't have nightmares when they're being observed. So it's kind of like, yeah, it's kind of like one of those things that once you start looking at it, it's like it's not going to happen as often. And so it makes it just that much harder to really kind of understand what is going on.
Right, right. It's kind of like when your car breaks and you bring it in. It never makes the noise when the mechanic's there, but always when you're driving it.
That's a great analogy for that.
So, okay, so we've talked a lot about the different types of conditions that may mimic nightmares and nightmares themselves. I'd like to be able to now talk a little bit about nightmare treatments as well as treatments for some of these other disorders that we're talking about, and then maybe we can talk about some actual case examples to kind of bring it to life. But is there treatment for nightmares first off, and if so, what does that look like?
Yeah. Fortunately, there are treatments for nightmares. There's medications that can be used. The primary one is called prazosin, or the other name is mini press. Um, and there's a good, decent amount of research with that. A lot of people have success with it. A lot of people, though, don't really want to be on medication or to experience, any potential side effects. Also, um, for some people who take something like prazosin or minipress, they say that they still wake up feeling like they had a nightmare, but they don't remember the content. So for a lot of people, that's a huge gain. Like they would much rather have that and not remember the content because, I mean, really the content can be quite disturbing.
Mm-hmm.
So I think that's a big gain for some people, but for others, they're still really bothered by having the awakening in the first place and getting that disturbed sleep. So kind of some pros and cons there. Um, but
So
we also have
before you,
oh yeah, go ahead.
I was gonna say, but before you go past that one, what do you know? Like, what type of medication is that in terms of like what's it doing? Do we know what it's
Yeah.
how it
Oh,
works?
yeah, it's a blood pressure medication.
Hmm.
And yeah, it was sort of a kind of an accidental discovery of it improving nightmares. Like it was being given to a veteran um, uh, for another indication, and then they kind of noticed, hey, this is helping with the nightmares as well. And so there's been, several research studies kind of following up on that, which is, kind of an interesting line of research there.
Wow, that is interesting. But I hear of so many stories where medications are discovered, by mistake because they were made for something else, and then they realize it's doing whatever this other thing
Yeah.
is. So but it's great that it's available. So
Right.
so
And I was just going to say it's actually a relatively low cost one as well, which is also really
oh,
good.
that's a total benefit. Okay, so I realize there's other treatments, and I want to get into those, but let's take a quick commercial break, and we'll come back and continue talking about treatments. You're watching Sleep Science Today. If you enjoy our show, please help support us by pressing the like button, subscribe to our channel, and hit that notification bell. It'll really help us get seen, and it'll help you stay informed. All right, we're back on Sleep Science Today. We've got Dr. Kristi Pruiksma, and we're talking about treatments for nightmares. So we just talked about medication. What other types of treatments are out there?
Yeah. So I think a lot of people are surprised to learn that there's actually behavioral approaches for treating nightmares. Um, it seems kind of surprising because I think a lot of people who experience nightmares feel like they're so, out of control, and they can't really predict when it's going to happen or whatnot. That actually a lot of people don't bring nightmares up to providers. I think partially because they think that there's not really anything that can be done, but also I think some people think, oh, somebody's going to think I'm crazy that if I tell people I have this. Or on the flip side, I definitely talk to a lot of service members who just think it's normal. Like, doesn't everybody have nightmares like this? Like, because maybe in their circles that is the case. So yeah, there are behavioral treatments, and there's kind of a lot of different terms used to label and name what the intervention is. Some imagery rehearsal therapy is one of the most well-known. Kind of a variation on that is called exposure, relaxation, and rescripting therapy. There's been studies of I won't get too much into the details, but we're we're kind of trying to move more towards using the term cognitive behavioral therapy for nightmares. Cognitive behavioral therapies are pretty widely evidence-based approaches for a range of conditions, and I think that it fits for to describe these approaches for treating nightmares as well.
So, so if someone is listening to this show and they have nightmares, can you give sort of an example of, they come to someone like you and they say, I've got nightmares and I want treatment and I don't want to take medications. What can I do? What would it really look like? Like, how much time are they going to spend with you? What are they actually going to be asked to do? Can you kind of tell us what that really looks like for them?
Sure, yeah. So usually it'll be about 4 to 6 individual or group, about 50-minute sessions. And one of the first things we want to do is really get a good assessment of what's going on. And that helps us know, if what we're doing is helping. And so we use like a sleep log for that. And this is something where we're going to ask people to track kind of like when they go to bed, how long it takes them to fall asleep, do they wake up in the night, how long, when did they get up in the morning, and how, did they have a nightmare, and how intense was it? Those types of things. So it's kind of a lot of questions at first, but people tend to get pretty quick at filling that out, and we encourage people to fill that out each day. And then we're going to use that information to really tailor the intervention for that particular person. So we mentioned earlier, nightmares rarely present by themselves. There might be insomnia as well. And so part of the cognitive behavioral approach is to look at some of these sleep habits and to provide some recommendations on just some healthy general sleep habits that are going to help anybody, and particularly somebody with nightmares. And the thinking on this is that if we can kind of help regulate that sleep rhythm, that it might kind of help reduce that sort of vulnerability for a nightmare occurring on any night.
So, so you were talking about sort of like image reversal or something along those lines. What does that mean? What does that look like?
Yeah. Yep. So that is a part that we will do kind of after trying to get some habits, sleep habits more regulated. Typically, we'll also teach some relaxation training skills. Like some things like progressive muscle relaxation or guided imagery, because we kind of want to get that foundation in place first. But then the imagery rehearsal part comes where we're actually going to ask somebody to identify a frequent or recent nightmare. And, in some of the protocols will actually, really go at that directly and really, do some exposure to it. We have them write it out in detail what's happening in their nightmare. And I think for some people might think, gosh, that's pretty mean. Like, why would you do that? Like, that sounds awful. And patients can feel like that a lot, but usually when we go through a rationale, it can be a really, really empowering experience, because there's this thing that's, kind of haunting them, that's just sort of happening in the brain. And like for most things, if something's really bothering you and you're able to like talk about it or write it out, writing, journaling for managing stress is actually really super helpful. it can really bring a lot of relief. And so because we know that that can be really helpful, that's something that we'll encourage for a lot of people to do.
Mhm.
Now, once that's done, a lot of what we'll do is also think about what might be some themes. So to kind of back up a little bit, when talking about nightmares, there's different types of nightmares also. So there's nightmares that maybe are like very trauma related, where it's like a replay. Like so, some individuals literally their nightmare is replaying a traumatic event over and over and over. For other people, there's some variation, like there's some part of a trauma that's part of it, but maybe there's different people there, or the scenario happens differently. And then for other people, it's more like dissimilar, where it's more like there's some kind of monster, some kind of weird figure or entity that's, doing something negative. So that can kind of range quite a bit.
Mhm.
In any case, though, some people have the same nightmare over, and some people it kind of is different every time. But usually there's some kind of theme that is happening in that nightmare, or a combination of themes. The 5 themes that we usually kind of look at would be things like, is there a lack of power and control, a lack of safety, a lack of trust, a lack of esteem, or a lack of like intimacy or like closeness with someone else. So if we can identify what those themes are, that kind of gives us a good like jumping point, for writing a new dream. That's what
Mhm.
the rescripting is what we're going to do.
Hmm.
When you're working on treating like a trauma itself, we're not going to work on trying to change a memory. Like we might think through like how somebody interpreting the memory, but we're not trying to change what happened, right? That doesn't make sense.
Right.
But with a dream, since it's a dream, and dreams can be really wild and crazy, we can actually change that. And we're going to write a new dream based on these themes, and then that's what we're going to rehearse and imagine. So um, when I talk about like changing that dream on according to that theme, so if somebody has a lack of power control, or they're really unsafe in the nightmare, then the idea is to write it in a way where they have increased safety and power and control, in some meaningful way. And
Mhm.
I can give some examples in a minute. But then the other part with that imagery rehearsal, we just came off of the Olympics, right? And I
Right.
bet I don't know, whatever you liked watching, most of the time they see the athletes kind of preparing, right? Like, especially the divers, they're like kind of swinging their arms around, kind of preparing for teaching their muscles what to do. I think it's the same thing where we're wanting to imagine what kind of dream we want to have, and it actually sets us up. Most people don't have the dream, some people do, but it just kind of changes how the dream life occurs that night.
Hmm. So by
So I just said a lot.
consciously, yeah, no, and the part I want to make sure I have clear is, so by consciously sort of re-scripting this episode, that tends to carry over into the night when they're sleeping the next night.
Hmm. Hmm. Yeah,
Wow.
that's it. And I kind of think of it, as sort of like we're priming a different emotion, we're priming a different experience. So by priming, an example I often give is like, if you kind of get to the point where like, maybe I need to buy a new car, maybe I'll get a Kia Soul.
Hmm.
And then once you start thinking that, your brain is more primed to notice Kia Souls around. And so
Hmm.
then you'll start noticing them everywhere. There aren't suddenly more Kia Souls on the road. Your brain is just primed to notice them. So I think
Right.
that's sort of what's happening here too, is that by imagining kind of a dream going in this different direction, we're priming the emotions and the memories, that are being kind of processed as we sleep, to go in a different direction.
Interesting. Wow. I never
Yeah.
would have thought of it that way, but okay. I mean, it certainly obviously works, or you wouldn't be doing it. So let's do this. We have a little bit, roughly a minute left in the show, and so Is there an example you can give us of a real life case that you worked with?
Yeah, so there was a specialist that I worked with. This was several years ago now, and he's given me permission to share. But we successfully treated his PTSD, and at the end of that, he said, "You know what? I'll just get used to the nightmares every night." And I was like, "No, let's see what we can do about that." And so he had been assaulted by several members of one of the other forces where he was deployed. So physically and sexually assaulted by 6 other men.
Mm, wow.
And so his nightmare was mostly replaying that event up to the, from being led to where these men were. And until like kind of the first blow happened, and then he wakes up. So his nightmare is mostly sort of replaying that. Now, when I first introduced this idea, he was, he was on board. We'd already been working together a while, so there was some level of trust. But also, this seemed kind of really strange to him. So he wrote a prescription that was kind of sarcastic, like it was kind of like, things got better. I'm riding Falcor, the never-ending the dragon from the never-ending story. It rains candy. GI Joe, like go. Like it. So it kind of got this like sort of sarcastic tone, and I just thought, you know what? Let's experiment. Let's see what happens. And so he didn't really practice the imagery rehearsal very much that week. He maybe once or twice, but the next week he came in and said, "You know what? I had dreams that were sort of abstract, like that weren't like this vivid thing for the first time in like that I can remember." So something was happening, and that kind of got him a little bit more like, "All right, I'll give this a better try." And then he wrote this. I mean, he's a really good creative writer. He wrote this really amazing new script where, in the nightmare, he sees his body walking and he's like trying to stop and he can't because he knows what's going to happen. And in his prescription, he's able to like notice, wait, no, I can control my body. He takes control and he's able to stop the assault from happening. And he's able to like call for the morning and call for like, safety to be around him, like that there's greenery and there's water coming by and he's in this new place where he knows he's safe. His nightmares went away. His sleep improved, his PTSD further improved, depression continued to improve. So we were able to kind of add on to like the progress we had already made, to where he was just kind of in a completely new place and ready to like build on his life in a new way after that. It was really, really cool to be a part of that process.
Yeah, I bet that's very rewarding for you as someone who's helping him. So I'm sorry to say that we're out of time for today, but Dr. Pruiksma, just teaching us about dreams and nightmares and the fact that there are treatments available. This is all good news for anybody out there who's been struggling with this. So I appreciate you taking the time. I want to remind our listeners that if you visit us at www.sleepsciencetoday.com, you can sign up to be on our mailing list, get a free ebook. You'll have access to all of our podcast episodes and additional information that is not available to the general public. So again, Dr. Pruiksma, thank you so much for your time.
Thank you.
Thank you for listening to Sleep Science Today and learning how to sleep better with your host, Andrew Kolsky, on UK Health Radio. For more information on how you can achieve better sleep, go to sleepsciencetoday.com. Remember, sleep science today and sleep better tonight.